Welcome to William Beaumont's Labor and Delivery Unit. My name is Major Mascal, the Clinical Nurse OIC or Nurse Manager of the Labor and Delivery Unit. We are located on the 4th floor of the main hospital, and we are staffed with nurses and providers 24/7. If you are over 20 weeks gestation and have an obstetrical emergency, we can see you in our triage department. Some of the concerning symptoms that we can see you for are if you're having 4 or more contractions per hour that does not subside after drinking 3 to 4 glasses of water, emptying your bladder, and laying on your side for an hour. If you're leaking clear fluid or have vaginal spotting or bleeding, if you have a fever greater than 100.4 degrees, burning on urination, any vaginal discharge that is malodorous, if you've been involved in an automobile accident or experienced any trauma to your abdomen. Slipping and falling is a common example of that. Upon arrival to the L&D triage desk, please have your ID card ready so one of our MSAs can check you in. They will ask you a few questions, then will notify the triage nurse. Please remember that our L&D triage department is much like an ER, but for our pregnant patients. Patients will be taken back to their rooms in order of medical urgency, so please be patient with us. The nurse will then call you and escort you to a triage room. Once in the triage room, you'll be hooked up to the monitors so we can evaluate what your baby and uterus are doing. Your nurse will ask you a few more questions to get a picture of what's going on and take your vital signs. Once that is complete, your nurse will report to one of our providers. At that point, the provider will review your medical records and see you as soon as possible to evaluate you. If you are being seen for a labor check, you'll be admitted for one of 2 reasons. If you are in active labor, meaning your cervix is about 5 to 6 centimeters, or if your water is broken. There are also other reasons you may be admitted to labor and delivery, but the provider will discuss those with you as needed. If you are being admitted to labor and delivery, your nurse will get your admission started and escort you to your labor room. Once in the labor room, you'll be connected to the fetal monitor again, and your nurse will ask you more questions as part of your admission assessment. A few basic things that will be discussed are your plan for pain management, if you'd like your support person to cut the cord, and review the medications that we will give your baby once delivered. You will remain in this room during the duration of your labor, delivery, and for about 2 hours after your delivery as part of your transition period. After your transition is complete, you'll be transferred to the mother-baby unit. We look forward to working with you through your labor and delivery process. Thank you for choosing the William Beaumont Labor and Delivery team to be part of your baby's birthday. Now we will leave you with our mother-baby team for the remainder of your inpatient stay.